Hello class, so today I'm going to be talking to you guys about cystic fibrosis. This was the topic that I chose for our, the clinical science class. So first of all, what is it? So it's an inherited lung disorder that affects the lungs and other organs of your body. Most people produce excess of fluids within the lining of our walls or in our vessels. However, people that are diagnosed with cystic fibrosis have thicker, more sticky substance than like lubrication that we should have. So what this causes is airways and ducts to collect excess dirt or any pathogens or bacteria that's there, and it will turn into a yellow substance like kind of like wax but not as thick, and it will plug up the pathways such as like the airways and the alveoli within our lungs. According to our book, this disease affects approximately 30,000 children in the United States, and worldwide is 70,000 in the world. But we have to remember that this book was made in 2011, so it could be higher values than what was indicated in the textbook. So these are just pictures of what it looks like. It's a more colorful image than what you could see in the x-rays. Again, as you see here, there's the plugging up of the airways, like I mentioned. The top one is what normal airways should look like, so it's clear, you're able to breathe. The bottom one, it's harder to breathe. You start to get this yellow-like substance because you're getting dust and whatever is trapped in your lungs, it starts to accumulate, and yeah, so it starts to plug up right here, so it's harder to breathe. So again, I want to show you what the real life images will look like. So to the right here, you have someone that has healthy lungs, so you can see that it's like dark. These are the lobes of the lung. And then you compare it to someone that has cystic fibrosis. You can see all this fibrocytic tissue, and the earliest, the earliest manifestation of cystic fibrosis on the chest radiographs consist of round, poorly defined opacities. So as you can see, there's many right here. And on this side, it just shows you the progression from 6 months to 5 years to 10 years. So etiology, cystic fibrosis is caused due to the mutation of chromosome 7. So the gene is a CFTR. It becomes mutated because both parents have passed down to the gene to their child. So if both parents pass it down, that's when it is expressed. However, if one parent passes it down to their child, they become a carrier, which then they can pass it down to their child. And if their parent, so their spouse, has that gene as well, then it gets expressed. So that means that their child will get diagnosed with cystic fibrosis. Yeah, so it causes a malfunction of mucus producing cells, which are located within the lungs, pancreas, and so with cystic fibrosis, it doesn't just affect the lungs, it also affects like the digestive tract, because that's also where we produce mucus. So they'll have signs and symptoms. I'll go ahead and explain on the next slides. But the most common population that it affects is the Caucasians. So, but both male and females are equally affected, so it's not gender specific. So signs and symptoms. So like I mentioned, it doesn't just affect the lungs, it also affects the digestion. So some symptoms include malnutrition, which means they're not getting the proper nutrients, aren't being absorbed. There's excessive sweat released when sweating, diarrhea, fatigue, coughing, such as like coughing up mucus, hard stool, lung infections, and diabetes sometimes, not usually. Here I mentioned I wanted to show you guys the different types of phlegm. So white and clear means there's no infections. Usually when we get sick, such as the cold, we sometimes tend to have this, but then sometimes it starts to turn green. That means we have a bacterial infection. When it comes to red, that means we have a lung injury or malignancy. There's something else that's more concerning going on. And then lastly, we have the brown, which is the color that people that have cystic fibrosis tend to see. It's between a yellow brown. And then these are like a little fun way to show the signs and symptoms. Salty tasting skin, because due to the excessive sweating, they have chronic respiratory problems, the clogging of the mucus in the bronchial tubes and the alveoli, I mean. And then poor weight, because they have malnutrition. It's affecting their digestive tract. They are going to lose weight. And then hard stool or diarrhea, depending on their type of symptom. So it affects like the rectum. Go ahead and move on. So prognosis, there is no cure. It's a progressive disease. The life expectancy, however, has gone up. The book had indicated that they can live up to their 50s, or actually, no past their 50s was the book. However, Mayo Clinic, I looked it up, and it says sometimes they can live longer past their 50s because medicine and technology has increased. So that's really good. Patients can attend school and work, and they tend to live out their lives longer than what was mentioned in the book, which was 2011 made. So the cause of death is due to pulmonary and intestine infections. It's not really, I mean, it's the cystic fibrosis is an issue because it's clogging up their lungs, so that way they're not able to breathe. But because it's clogging it up, it's more like a secondary cause, if that makes sense. So medical intervention. So for medicine, genetic sequencing has been used. So when a child is born, they go ahead and do genetic tests to make sure that the child gets the earliest intervention. That way they're not missing anything, and that way they can get the therapy medication they need before it starts to progress. That way they can live a longer life. So certain things that are mentioned for medical is oxygen therapy, which is like ventilators, the oxygen masks that you're used to walk, they're the portable ones, positive expiratory pressure therapy, which was mentioned in one of my articles that I'm going to mention, antibiotics such as to help fight the bacteria that they accumulated because of the cystic fibrosis. Humidifiers will help open up the airways for people to breathe. This ones tend to be used more at night when you go to sleep. Bronchodilators such as inhalers, steroid, so you will go ahead and push in, so that way again it strengthens up your lungs. And then pulmozine, which is a mucus thinner. This helps to thin out the mucus so it's able to run and come out of your nose, or you're able to swallow it, but sometimes it causes infection down there. But it helps, for the purpose of it is helping you to breathe. So all these are used to help to treat the symptoms, but there's nothing that can actually cure or help with the cystic fibrosis. So here's the pics of medical intervention. Like I mentioned, the oxygen therapy, the PEP therapy, and then we have humidifiers here, as well as like the ones you can buy at the stores that help to get the whole area, but these are more concentrated in your nostrils. And then we have the inhalers, and this is just how to use the pulmozine. Okay. So for physical therapy interventions, the most commonly used intervention is postural drainage and breathing exercises, as well as aerobic. So postural drainage is when you have, I think I have a picture here. So postural drainage is for loosening up the mucus in the airways of the lobes. So you're having the child in this case lying down on their belly, and they are inclined, so that way the mucus can come up and out through their mouth. They can cough it up, and they're able to breathe better. And also it helps prevent more infection from occurring. And then for physical therapy, I also put swimming and biking because we want to work on the aerobic exercises, which helps thin the mucus lining because it's clogged up, and then breathing exercises. This way you help to expand your diaphragm and to relax it as well. You want to strengthen up those muscles. There's a psychology behind it, not just for the person with cystic fibrosis, but I was reading that there's also like psychological issues with the parents because they believe that they feel guilty for passing on this disease to their child, and they have no control over it. It's kind of sad because they know like their child, there's no cure, so they don't want to see them suffering. So sometimes they fall into depression, or even the person that has cystic fibrosis. So it helps to try to be encouraging and be, like the light there for them, especially if we're going into this field and we have to help treat someone that has cystic fibrosis and help with the symptoms. So just wanted to mention that. So I had 2 articles for this one. There was a study done on participants that had cystic fibrosis, and they realized, cut it short because I'm going over time, but the participants that were in physical therapy, or that did the physical activity, they realized and they confirmed that it helped to clear the airways by thinning up the mucus. There was a couple of participants that were more sedentary, and they did notice a slight correlation to that since they didn't meet the target, they did notice that it was affecting them more rather than the people that were the participants that were doing the aerobic exercise training. However, there are further studies need to be considered to determine its reliability and validity. And then the next one, this was more of a medical intervention. So the FEP of the clearance, there was no major difference between using that and other airway clearances, but it is important to make sure you are clear. And then here's my summary page, so you guys can pause it or take a screenshot, whatever you guys want. And then here are my references. Cool.